Hello, everybody. Welcome. My name is Jennifer Chu, and I'm the founder of ITR Physical Therapy. And I'm so excited to be welcoming Dominique Hoffman to do this free webinar on inflammation and your gut health. Today, she's calling it the digestive system, your gateway to health. Now, Dominique is the founder of the Micro Riche diet based on the Mediterranean diet. She holds a master's degree in clinical nutrition from the University of Bridgeport and has studied with lots of people in the field of nutrition and biochemistry. And she has been in this field since, well, she started Zizania in 2007 and has been working with many people successfully to manage a multitude of health conditions. Take it away, Dominique.
Okay. Well, welcome everyone. As Jen said, I have been a clinical nutritionist for 18 years. And in the 18 years I've been doing this, I've seen all kinds of health problems. And what is surprising to people is how many things can be fixed by changing your diet. A changing diet is so effective, it is so powerful, and it's the only medicine that doesn't have side effects. And it's actually very affordable because you have to eat anyway. So why not eat the right thing? So I would like to start right away, and we have lots of material to cover. I hope you're ready. Um, so the first thing we're going to discuss are this is going to be all about gut health. I will be mentioning other topics, but only as they relate to the gut, but the focus is going to be on the health of your digestive system. So we'll talk about the causes of gut inflammation, types of gut inflammation, and then how this inflammation affects the entire body. And then we'll talk about the impact of an unhealthy digestive system on the pelvic floor. And then I will give you some steps you can take starting today to improve the health of your digestion. So the causes of GI inflammation are multiple. It can be a poor diet. A poor diet doesn't mean that you're not eating properly. It can mean that you have lots of food allergies, or you have one food allergy that you're not aware of, and it's wreaking havoc in your digestive system. As we will, when we get to those topics, you will see that lots of food allergies are very hard to diagnose because at the beginning they have no symptoms, and then they snowball and you have very strange symptoms. I will have a couple to share with you that are totally strange, and they are related to diet. Infections, bacteria or viral or parasitic. Now, when we talk about parasites, lots of people envision this huge tapeworm or some kind of monster, living inside our intestines. It's not always something you pick up externally, like through food. When there is an imbalance in the gut bacteria, some of them become parasitic because they grow in population, and either they steal food from the other organisms that will die from starvation, or they just eat them themselves. All life forms competes for territory and food. It's just the way it is. Lifestyle choices, it's still not clear how alcohol causes gut disruption, gut problems, but it's still a factor. The one that I worry most about is soda. Soda have lots of ingredients that are detrimental to the health of your digestive system. So if there is one easy thing to eliminate from your diet, it's not sodium, as most people would do. It's actually drinking diet soda. If you want to have a Coke, have it with full sugar. Not that I'm advising you do, but full sugar is better for you than artificial sweetener. Excessive intake of antibiotics. If you take antibiotics, you don't follow up with probiotics, especially if you take antibiotics long term, that can kill the good bacteria as well, and that will create all kinds of issues we will be discussing. Stress. When you are stressed out, your digestive system shuts down. So there is actually no blood flow to lots of the organs, and the communication between the gut and the brain is disrupted. And that means food doesn't move. It can sit there and ferment or petrify and create gases and lots of toxins that will cause tissue damage. Radiation therapy, this is one where nobody has a choice. If you have to get radiation therapy, then you do. But at the end of that therapy, you have to follow up with a gut restoration protocol. And then there is genetic predisposition. Some people will be intolerant to gluten, others can be intolerant to all grain, and other people can deal with gluten just fine. Common symptoms. Symptoms of GI problems can be all over the place. You can have GERD, you can have acid reflux, you can have gas and bloating. Constipation is very common. And in the case of dairy allergies or any other food allergy, we can see people alternating between diarrhea and constipation. And severe constipation can cause stools to leak as well. If you feel stuffed or lethargic after eating, that's a sign you're not digesting properly. If you have high sugar craving, that is also an issue. We will get to that later. Developing rashes, skin rashes, swelling, puffy face, swelling of the hands, fingers, legs, and feet are all a sign of something that has gone wrong and that needs attention. Incontinence can also happen as a result of constipation or inflammation of the pelvic organs. So types of gut diseases, we have, they are called IBD, inflammatory bowel disease, Crohn's and ulcerative colitis. These are serious diseases. They need both nutritional management and medical intervention. I won't be discussing these because we would be here all day. Each one of these need a presentation of its own. So I won't cover them. But the things that I will cover are the things that we can solve with nutrition and without medication. That's IBS, leaky gut syndrome, SIBO. If you haven't heard of that, that's small intestinal bacteria overgrowth. And then, of course, Candida. Candida is very common, but lots of doctors don't recognize its presence. I have a story for you about that too. IBS is a disorder of the colon, but it doesn't cause any change to the structure. IBS causes unpredictable bowel habits. You can have diarrhea, you can have constipation, you can alternate between both. I have a lady who all her life she was afraid to travel or to go for long walks or hikes because she never knew when she would need to go to the bathroom. And whenever she needed to go, it would be urgent. It had to be done right away. And she would go to the bathroom about every 3 to 4 days. So that's alternating. And believe it or not, we fixed that in about a week. Her stools are still not normal, but that urgency now is gone and she goes regularly. So it is fixable, but it does need a serious intervention. IBS can cause pain, cramping. It's always accompanied by bloating and gas. And you have to check if that gas smells really, really bad. That's a sign that there is dysbiosis. Dysbiosis is a serious imbalance in the microbiome. You have more bad bacteria than good bacteria. Symptoms, severity of symptoms can vary from patient to patient. IBS is not a one size fits all. Everyone has different symptoms and there are different levels of severity. But constipation is definitely common. And so far, there is no medical treatment. Your doctor can prescribe medication for the diarrhea or to help with constipation, but there is really no serious medical intervention that will reverse IBS. However, this is something we can successfully treat with nutrition and a change in an anti-inflammatory diet. So what causes IBS? There are speculations that it's the problem is between the brain and the gut communication. There is a dysfunctional there in the way the nerves are communicating. The contractions also can be too slow or take too long. And when that happens, the food stays there in the gut for too long, and that allows for the bad bacteria to develop. It allows for fermentation. Fermentation will create gas and bloating. So there is also disruption in nerve signals, and the intestines get overly stimulated, and that can cause cramping and pain. Bacterial infections can also cause IBS. Remember, I was talking about the microbiome. If you have dysbiosis, that can cause gas, bloating, cramps, and if you have leaky gut, same thing. So changes in the microbiome would definitely lead to IBS, and so do food allergies. Leaky gut syndrome is actually more common than you think. You don't hear about it a lot, but it is now recognized as a medical condition, and it's actually very easy to treat, but not necessarily with medication. There is no medication for leaky gut. It's caused by dysbiosis. It's caused by damage to the lining of the intestines, either by bad bacteria or by food allergies when the immune system attacks that part of the body. And you will see how the cells, the epithelium, the layers of the small intestines are damaged, and things that are not supposed to, food particles that are supposed to be catalyzed by enzymes so we can extract nutrients, are passing through into the bloodstream whole, and they trigger an immune system response. So symptoms can take a very long time to develop with leaky gut. It can take a month to a year, and some people don't listen to their symptoms, so it can take even longer. And then there are all kinds of other health problems that would follow. A leaky gut will not show up in a colonoscopy. I have lots of patients who say, "Oh, I had a colonoscopy, it didn't show anything." A colonoscopy is kind of like a mammogram. It looks for lesions, it looks for bumps, it looks basically for tumors, and it answers only one question. Yes, I see something. Nope, I don't see anything. It doesn't give you the details, and it definitely cannot provide an assessment of your microbiome. Only a stool test can do that. So what causes leaky gut? Medication, definitely. Stress, low hydrochloric acid, which is the digestive juices in the stomach. When the stomach is alkaline, bacteria can thrive, and it can travel further into the digestive tract. Diet poor in fiber and high in protein. So the reason for that is because fiber does so many things for you. It helps the stools to move. It reduces it. It feeds your microbiota, and it allows for things not to sit there for very long. When your diet is high in protein, things like meat and cheese or eggs take about 48 hours to make it through the GI. That's a long time. If you have slow motility, if you have high stress and your intestines are not moving the way they should, that food will sit there, and that will putrefy and increase the bacterial load. But with plants, if you have more fiber in your diet, if you eat beans, for example, that would take 24 hours to make it through your digestive system. Accumulation of toxins that cannot be broken down. Again, if you have low hydrochloric acid, or you have medication and your GI is not effective at breaking these things down and excreting them, they would sit there and cause damage. Gluten and dairy allergies are notorious And then secretion from harmful bacteria. If we have this issue where the food is sitting there too long and there is dysbiosis, bacteria doesn't sit there static. I mean, it consumes and excretes as well. And those excretions are toxins that will harm your digestive system. And then pathogens that survive the stomach and pass on to the intestines. Destruction of the gut. So when all these things are happening, it destroys the layers of your intestines. The gut stands for gastrointestinal lymphoid tissue, and that's the epithelium. There is a layer of bacteria in there. There are enzymes, and all that can get damaged. So any changes in the integrity of that layer will allow the passage of food particles to be inside, to go into the bloodstream and trigger an immune system response. And this is what the cells in your gut look like. So here where it says normal intestinal permeability, you can see that the cells are all together, and on the top there, those little beads, those are enzymes. Everything is working properly. Food comes in, it gets metabolized, nutrients are extracted, and then they are sent the way they should be sent into the bloodstream to travel to tissues. If you take a protein, for example, protein undergoes a lots of changes. It arrives in the stomach as a large molecule. It gets denatured into what's called polypeptides. Polypeptides are like these necklaces, if you prefer. Amino acids are like beads in there. And then when it gets into the intestines, these polypeptides are broken down into peptides, and then into amino acids. So only amino acids can pass into the bloodstream. But when you have a leaky gut, you see what's happening here at the bottom is the protein called junctions. These proteins act like a glue. These seal these epithelium cells together, and once they are damaged, then your gut has like all these holes, and these polypeptides can pass through and create an issue. Small intestinal bacteria overgrowth. This is becoming more and more known. There was a group of doctors in Australia who created what's called FODMAP. I think lots of people are now becoming more familiar with that because the doctors are prescribing FODMAP as a solution to SIBO, but it's really not the best solution. FODMAP is for IBS, not SIBO. However, it is one solution not available out there. So there are there is a little bit of bacteria in the small intestine, but when there is an injury, when there is stress, when something goes wrong, that bacteria can grow exponentially to form large communities, and that causes also leaky gut. So there are multiple causes that would allow that to thrive. And then the destruction of the enzymes will prevent you from extracting your nutrients, and it will interfere with absorption. So if you have SIBO, you're going to have all kinds of health problems and possibly related to malnutrition. So what causes SIBO? Believe it or not, excess intake of probiotics can cause SIBO. I had a patient like that. She was prescribed probiotics after she took antibiotics, and then she kept taking them, I think, for a couple of years. She ended up with an advanced case of SIBO, and she's still in treatment for that. Because probiotics are not vitamins, they are bacteria. You take them for a limited amount of time, a month, 3 months is the maximum, and then you stop and see how you're doing. A weak immune system, especially after medical treatment, slow motility. if your GI is moving too slow, there are going to be all these pockets in there that would create really a favorable environment for bad bacteria to thrive. And one common factor of slow motility, I mean, there are several factors of slow motility, but surgery is one of them. In rare situations, it's not very common, but in rare situations, there is a structural abnormality to the intestines. And then things like diverticulitis or leaky gut, as we discussed, and of course, reduced hydrochloric acid, but also nerve damage that would cause the intestine to move too slowly, and of course, obesity. And then there is candida. That's yeast overgrowth. It's a very serious infection. I had a lady who was suffering from that for over 20 years. And so I told her what was going on. I told her what the solution, what we should be doing. And she went and consulted with her sister, who was an OBGYN. And her sister told her there is no such a thing. Yeast doesn't live in the gut. And this woman's candida was so bad, she said she felt like things are moving under her skin. So yeast overgrowth is very serious. So Candida albicans is the guilty party. It's a very common fungus, and it's present all over the body. You will find it in a small amounts on the skin, in the mouth. It's present in the digestive system, of course, and also in the vagina. And I want to make a little pause here to talk about the vagina, because when women undergo menopause, that that environment is disturbed. We have three microbiomes. One it's in the mouth, one in the gut, and one in the vagina. And during menopause, due to lack of estrogen, that bacteria, that microbiome, shrinks. And that leaves the vagina exposed to all kinds of pathogens, and women end up getting all kinds of infections, UTI. So that is something to be aware of, and making sure you don't have yeast overgrowth in the gut will help. The yeast in the vagina is controlled by the microbiome in your gut. So yeast infections can be on the skin. The would cause rash. If you had children, you have seen diaper rash, I'm sure. You can have yeast infection, a fungus in your nails. Some people have a blue, yellow, thick, all kinds of colors on their nails plus thickening. Thrush in the mouth, you will see that mostly with babies because they get it when they exit the womb. They get it from the mother, and of course you can get it in the vagina. So this here we have a picture of someone with nails that are infected with a fungus. You can see it's white, you have all those white flakes, it's thick, and this is not an advanced case. This is a baby with thrush, and you can see the tongue is white. It does happen to adults to have yeast overgrowth in the throat or on the tongue, but it's pretty rare. The first symptoms of Candida are sugar craving. You will be craving sugar like crazy. Either it's refined sugar like candy, ice cream, or just pasta and rice and bread, lots of refined carbohydrates. Itching on the scalp is pretty common. Itching around the anus after you pass stools, and then recurrent vaginal infections. If you have any of these symptoms, chances are you have yeast overgrowth. And then in the most advanced cases that can cause abdominal distension, bloating, constipation. And when it's really advanced, like the lady I've been talking about, she actually developed schizophrenia. So it can definitely affect your mood and your neurotransmitters and create fatigue and all kinds of, and then it snowballs from there. So the treatment, there is medical treatment. You can take botanicals for that. There is one called candibaxin. I think oregano oil would work too. And there are a bunch of combinations that are specifically designed for that. This is not something you can pick up in the grocery store. You have to consult a health practitioner. And then there is the anti-candida diet. This is the hardest diet there is because you cannot eat any sugar. I mean, no grain, no pasta, no cereal, no fruit. So you're left with maybe a little bit of meat and lots of greens and vegetables. You cannot have carrots or potatoes. Lots of vegetables you don't think have sugar would have sugar. So it is a very tough diet, but you have to do it for at least 3 weeks. You can add to that water fasting or breath fasting. And then depending on the severity, after that, you need to follow a GI restoration protocol and then get tested to make sure that this population is properly controlled. So whenever you have digestive problems, the whole body suffers. It just snowballs from there because your digestive system is in charge basically of life because it controls nutrients. If you have all these infections, if you have leaky gut, you're going to be malnourished. And if you have lots of inflammation, your nutrients are going to be devoted to detoxification. The liver is working constantly around the clock to try to clean all that up. And of course, it won't succeed because there is always more tomorrow. Recently, I have a lady who had a very swollen belly, and she said she was like this all her life. And when I touched her belly on the left side, it's like there was this huge oblong stone, as if she was pregnant and there was a baby there. It was really huge and it was very hard. So she said, "Oh, no, I just need to do sit-ups." And, this is not something sit-ups can fix. So after a couple of weeks of the new diet I put her on, her bellying started to get softer. It wasn't as hard, and she said she dropped 2 pant sizes, and this is just in a short period of time. And the other thing that happened is when I examined her, she had very swollen legs and very turgid, really hard. And that also got softer, and the swelling went down. But she doesn't want to do anything because she doesn't think she has a problem because she doesn't have any symptoms. To me, bloating is a symptom. So it's interesting how people react. So inflammation-related diseases, you can develop type 2 diabetes because your microbiome, if you have inflammation there, if the signals between the gut and the brain aren't working, it affects your glands, and the pancreas is a gland, and that will affect your insulin. You're going to secrete more insulin, and all your sugar will be transported into fat, and you're going to have malnutrition. You're going to be eating more. You'll be gaining more weight. It's a roller coaster. Rheumatoid arthritis is a result of inflammation. CRPS is a very rare condition, but it is extremely serious and debilitating. This is when the nerves send signals to the brain, signals of pain to the brain. Any kind of touch, some people can't shower, some people can't walk, they end up being on crutches or just confined to a wheelchair. The pain is just excruciating. I had a lady who had CRPS, and she had, from the inflammation, her lymph node around her neck were so swollen, her neck was bulging out. Her doctor told her she should have the lymph node removed. That would have created other issues. So you can see how inflammation affects every organ in the body. And I told her, I said that this disease sounds to me like an inflammation of the nerves. And when we started working together, I told her what we're going to do. And she goes, I can't eat this way. My husband wouldn't do that. I'm like, well, do you want to feel 50% better, 75% better, or 100% better? any way you want, I can get you there. But ultimately, you decide. So she reluctantly followed my advice, and I kid you not, within 1 month, her spleen went to normal, the inflammation around the neck was gone, and I think 2 months later, she started playing tennis. Lupus, very common. I have actually a testimonial on my YouTube channel of someone who was debilitated for 6 years, and we were able to get her out of bed within about 4 to 6 weeks. Inflammation can also lead to cancer because chronic inflammation weakens the immune system. And when the surveillance is down, abnormal cells can sneak in. And the release of inflammatory cells like cytokines, they release all kinds of toxic compounds that drive tissue damage, and that will lead to DNA mutations. Cancer cells will always thrive in an inflamed environment. They create a network of blood vessels to nourish the tumor, they suppress the immune defenses, and they will build a microenvironment to support their growth and, of course, spread. And then tumor growth, of course, creates inflammation. So how does that relate to the pelvic floor? So things that damage the pelvic floor are obesity, childbirth, radiation therapy, and back pain. But the things that we're concerned with here are the things that relate to the digestive system, which is constipation and bladder inflammation. So chronic constipation causes straining of the muscles, and that leads to very weak muscles, and that stresses the organs and the nerves around the bladder. So that can lead to bladder dysfunction. You can have accidental leakage, both from the bladder and from the rectum. And when the rectum, if you have chronic constipation, there are things that sit there for a long time that causes the rectum to enlarge, and it pushes the bladder, so the bladder can't really fill up and expand, and that would cause it to leak as well. Bladder inflammation can be caused by bacteria, all kinds of irritation. Medication is a good one, and of course that environment is very fragile during menopause. So how to build a healthy GI? You need to tend to your little bugs that live there. The microbiome produces over 90% of serotonin, that is the happy hormone. It makes actually 70% of the vitamin K, that vitamin that you need for coagulation, so you don't bleed to death if you have a little cut. It helps to keep the bacteria in balance. We talked about keeping the vaginal microbiome balanced. And it releases what's called short chain fatty acids. These are little fats that feed your colon cells. Your colon wall, to be strong and healthy, need these little fats as fuel. Healthy gut-brain connection, very important for all kinds of metabolic functions. And also 70% of your immune system is in the gut. So to restore healthy GI, of course, this is just general because every situation will require individual attention. But in general, you need probiotics, but only if you need them, if you have a reason to take them. Do not take probiotics the same way you would take vitamins. Supplementation that is targeted, specific. Vitamin D, very important. Lots of people are deficient in vitamin D, so make sure you get your regular blood test once a year. This is done through your family doctor, and always ask them to check your vitamin D. Sometimes they don't because some insurance will not pay for that test. Medication, if you need a prescription that can help in certain situations. We talked about severe constipation. And then if you have leaky gut, or if you suspect you have leaky gut or SIBO or something like that, then a stool test will definitely identify what's going on in your GI and also will tell us how to fix it. Prebiotics now they're selling them into a pill. Prebiotics just means fiber. You can get that by eating leafy greens, broccoli, cauliflower. It doesn't have to be fancy. Always have a high micronutrients ratio to macronutrients. You need lots of fiber in your diet, you need lots of vitamins and minerals, but you don't need saturated fat, and you need only small amounts of fats, proteins, and carbohydrates. Healthy oils, I could spend an hour talking about oils. Um, there is medium chain fatty acids, polyunsaturated fat, and monounsaturated fats. And the ones you need are the polyunsaturated fats. That includes the omega-3. And of course, you can use the FODMAP diet, but only if that's appropriate. You don't just do FODMAP. FODMAP stands for fermented oligosaccharides, disaccharides, monosaccharides, and polyols. These are all carbohydrates in fiber in certain foods that some people can't digest. Remember, we talked about IBS, and these foods like beans or broccoli, they can cause gas and pain. And then an anti-inflammatory diet is always a solution for anything. It can always help. So you want to avoid food additives, artificial sweeteners, eliminate dairy. Dairy is the biggest allergen out there. 99% of people are allergic to dairy. And there are people who are allergic to dairy all their lives and they are never aware of it because the symptoms are not that severe and it's not enough for them to seek a solution. Reduce animal proteins. The less fiber and more protein and more meat you eat, the more issues you're going to have. Elimination of gluten if you suspect the gluten is a problem, and of course refined grain, refined sugar. These are usually treats. Your desserts, ice cream, and things like that are not required for your well-being, but they are things that make people happy. So make sure you keep that in control. The building blocks of an anti-inflammatory diet is good fats, herbs. I want to stop here to talk about parsley. A lot of people think spinach is high in iron. That is actually not true. Spinach is really not that high in nutrients. Spinach has nutrients, they are just not bioavailable because it's high in oxalates. Parsley has 3 times more iron than spinach. It's rich in vitamin K, vitamin C, vitamin A. It is a wonderful, wonderful herb. I use it actually as a vegetable, not as an herb. Teas, I am not sure there are advantages or any benefits to that, but if you like drinking tea, green tea, oolong tea, it can be beneficial. Fruit, most fruit will have antioxidants. The important thing is you have a colorful plate. Make sure your food always have color. Vegetables, onions, garlic, cruciferous vegetables, even potatoes. Do you see how you don't have to do anything fancy? You don't have to do anything complicated or expensive. These are all foods that are available in your grocery store. And please make sure you drink plenty of water, at least 2 liters a day. It's very, very important for so many things. Without water, you will run into more problems than you can imagine. Food rules. There are some rules that we all need to follow. Don't take nutrition advice from social media. There are so many theories, ideas, and fads circulating. It's hard to keep count. Weight loss diets or fat diets, especially those that you get from MLMs, are can do more harm than good. Carbohydrates are not your enemy. Carbohydrates, they are good carbs, they are bad carbs. A potato is a good carb. A cracker can be a bad carb. Again, it depends on the cracker. Excess protein intake can lead to depression. Um, and of course, the digestive issues because protein takes a long time to be digested. Don't avoid fat. It just depends on the type of fat. You don't need saturated fat, but definitely you need polyunsaturated fat, such as olive oil, um, walnut oil, peanut oil is fine. And then learning how to prepare your own meals and reading food labels. Don't buy anything canned, jarred, or bottled without reading the labels. Use medication sparingly. Every medication does one of two things. It can speed up a biochemical process or it can stop it. So if you take statins, make sure you take coenzyme Q10 because statins block the enzyme that produces that antioxidant. The SSRIs also deprive the gut of serotonin. That's why sometimes they cause constipation. And then PPIs are to be taken only in case of emergency. You don't want to take them long term. If you have a problem that requires you to take these medications every day, then you need to address that problem. There is a serious issue going on with your digestive system and it needs to be fixed. Medication, except in unusual cases, if you have Parkinson's, if you have type 2 diabetes that cannot be controlled, in certain situations, medication, epilepsy is one of them. In those cases, medication is lifetime. Everything else that can be treated otherwise, you want to minimize medication intake. And then you want to listen to the expert, and that's your body. If you have pain, if you have problems with your thyroid, if you get pancreatitis, there is inflammation that needs attention. If you have weight gain, insulin resistance, swelling, puffiness, if you suffer from chronic fatigue, these can be solved. And then digestion is definitely something that you notice always right away if you have bloating, gas, or acid reflux. And then the color of your skin. Lots of people have gray tone or yellow eyeballs, um, white tongue, white nails. White nails are a sign of protein deficiency. You can eat all the meat you want and you can still have protein deficiency. I've seen that in several patients. That's because they have low acid and they cannot, low acid in the stomach and they cannot metabolize protein. If you have sugar craving, remember the yeast overgrowth. If you find yourself overeating without any satisfaction, usually it's the case with type 2 diabetes. If you get the munchies at night, there is an imbalance in your diet, you definitely want to address that. So you want to take charge of your health. If the doctor says fine and you don't feel good, you want to find a solution. There is always a solution. You just have to find it. So having said that, before I open for questions, I want to tell you about a mini program we have put together. We discussed that with Jen that you might be interested in. It's a 3-week GI restoration. So week 1, it's called removal. We'll do kitchen inventory. We'll remove all the artificial ingredients, all the chemicals in your food. We learn how to read food labels, how to identify the most harmful food preservatives. And then you learn about grocery shopping, how to buy fresh ingredients, how to read those food labels and avoid what's called UPF, ultra processed food. You will learn to catalog your symptoms. We will do a weigh-in once a week. You will receive recipes and reading material to help you understand what's going on and what to do about it. In week 2, we'll do the repair. We'll cover the gut function, the role of the organs in digestion, and how a diet is going to help make that better. Will clear your detoxification pathways, will work on giving the liver the nutrients it needs. When we talk about detoxification, it has become a buzzword, particularly in the MLM community. Detoxification is not done by vitamin or shake or certain nutrients or certain food. Detoxification is done by the liver and the kidneys, not by food. But what we do is we make that possible by the dietary choices we make. How to repair and prevent gut function in the future. We'll discuss the role of fiber and how it's important for microbiome and which type of fiber, because fiber is pretty interesting. And then we'll talk about probiotics and what supplements you need. And in the third week, you will learn how to eat healthy without ever dieting again. You will get recipes here as well, and you will learn how to make healthy combinations. When we talk about nutrition, we talk about micronutrients and macronutrients. And it's the combinations of these two that make us healthy. It's a synergistic relationship between nutrients that create health, not one particular ingredient or one particular vitamin or particular food. So when we're thinking about September 13, 20, and 27th at 2 p.m. I believe these are Saturdays, and the cost will be $200 a person. We would need 6 people to hold the sessions. If we have less than that, obviously, I will be canceled. And if you want to stay in touch with me, these are my information. My website has all my information.
If you wish to give your feedback or have any questions, you may leave me a comment or contact me via my website, which is also linked below. Stay well and take good care of yourself.